Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's media availability. Spanish interpretation is available on ATXN 3. Today, we are joined by Dr. Desmar Walks, Austin Travis County Health Authority, along with a few of her colleagues from our area hospital systems. After introductions are complete, we will then open it up to our pool reporter who will ask questions on behalf of the media. Dr. Walks, over to you.
Good morning, everyone. Medical opinion may not be popular opinion, but I'm here with my colleagues with recommendations. The last time we were in stage 4 was February 2021. We did not have widespread vaccinations, so we had to rely on proven prevention methods to slow the spread of COVID-19, masking, distancing, and hand washing. As time passed, we relaxed our recommendations as more of the community was vaccinated and less of our loved ones were hospitalized, and we saw fewer deaths and case counts decreased. But we have to be flexible for the good times and the bad times. In just 5 months, we have evidenced 4 new variants of this virus. And the last week's data shows that the Delta variant is more severe and deadly than its predecessors. One big and concerning difference is that we are now seeing younger people in our hospitals. And my colleagues are here to elaborate on their experiences. New case hospital admissions of COVID have increased significantly. We now have a 7-day moving average of admissions of 34 per day. And that has crossed the threshold of 30 that we are using as our move to stage 4. Since July 4th, the 7-day moving average of hospitalizations has increased by 203%. So on July 4th, we had 63 admissions daily, and as of yesterday, we've had 191 daily. In less than 20 days, the number of COVID patients being cared for in our local ICUs has increased nearly 242%, rising from 24 patients in ICU on July 4th to now 42 patients in ICU. And that 82 patients in ICU, and that is an incredible increase that our hospital is going to be strained by. Our hospitals are going to be strained by. These alarming numbers place us officially in stage 4 on our risk-based chart, less than a week after moving from stage 3. We are asking Austinites and community members in Travis County to take action. This is a call to action. We recommend an additional layer of protection, even if you're fully vaccinated. Wear a mask at gatherings, shopping, dining, and traveling. This is to protect others, including those who can't get vaccinated. For those who are partially vaccinated or unvaccinated, we need to ask more of you. Avoid gatherings, except if essential. If you go out, wear a mask, and please get vaccinated now. Masks work. We know this because they worked last school year to keep infection rates down in our local schools, much lower than the community at large, in fact. Parents have a right to insist that their child wear a mask when in school. If you tell an Austin ISD that your child should wear a mask when in school, Austin ISD will make sure of that. and your child will have a great school year in person. We are all feeling fatigued, including those of us in healthcare. I have invited my colleagues to share their experiences and help everyone understand why we have to take and make these medical recommendations. And with that, I will ask Dr. Metzger to say a few words, but I want to say in closing, the way out of this is to test, isolate yourself if you're positive, wear a mask, and most importantly, get vaccinated. Dr. Metzger?
Yeah, thank you, Dr. Waltz. I'm Dr. Brian Metzger. I'm an infectious disease doctor here in Austin and the Director of Infectious Disease with St. David's Healthcare. And I want to start with talking a little bit about the Delta variant, since that is largely what has changed the game here locally and really across the country. These viruses, they continue to mutate and create new variants. While this Delta variant is about 50% more transmissible than the Alpha variant from the United Kingdom, that was 50% more transmissible than the original COVID-19 strain. The ability to replicate and cause these mutants, the reason that happens is because the virus is allowed to continue to transmit to folks and replicate. And in the case in this country, it's largely due to lower rates of vaccination than we'd like to see. We know that vaccines are effective at preventing not only symptomatic COVID-19, but also especially severe disease that causes you to land in the hospital. We also know that wearing a mask, as Dr. Waltz had pointed out, can help prevent the spread of COVID-19 to others in your family and in your community. Another important point I wanted to touch on was how much the demographics of this infection have changed in this country. You know, last year we were mostly seeing patients over 60 years old in our ICUs, in our hospitals. That has changed quite significantly. We're seeing the pandemic really take a toll on younger people. Last week, in fact, about half of the people hospitalized with severe illness from COVID-19 were under the age of 60, with about 12% of those patients being under the age of 30. And I wanted to make sure to relay what I'm seeing in my ICU right now. And I wrote down the ages of the patients that are currently in the ICU. And at the one hospital that I'm at St. David's Medical Center, and 9 patients are in the ICU there, and 7 of them are under the age of 50, with 3 of them under the age of 40. So we're seeing a lot of 30 and 40-year-olds, unfortunately, in the ICU. And that's pretty devastating to us to see that happen, especially since it's something preventable. We continue to see that the majority of people that are hospitalized are unvaccinated. Generally, less than 10% of the patients that we're seeing in the hospital with COVID-19 are vaccinated. And the vaccinated make up 60 to 70% of adults in our area. So 90% of the cases are coming from approximately 30% of the population. So you can see that disparity and how much these vaccines work if you were to receive one. It's now easier than ever to get a vaccine. They're free. You don't need identification to get one. So it's very important to get vaccinated to protect yourself, your family, and your community. It's also important to protect those that are still unvaccinated, especially children 12 and under, and also persons that are immunosuppressed, could be on chemotherapy, could be someone with organ transplantation on immunosuppressive medications, who the vaccine doesn't work quite as well. And so we need that herd immunity. We need to all protect each other. So how do we do that in the short term? We need to be wearing masks, especially in indoor environments with people that are not in our household. And we need to get vaccinated. We need to increase those rates of vaccination so that we can provide that herd immunity to our community. Thank you.
Thank you, Dr. Douglas.
Hi, my name is Dr. Elizabeth Douglas. I'm an infectious disease physician at Dell Medical School. And I did want to talk about vaccine and the vaccine hesitancy that we're seeing. I mean, Dr. Metzger did a very good job in really describing that patients are getting very sick, but over 90% of the patients that are in the ICU and very sick with COVID are patients that were not vaccinated. And I think that is really important to understand. It is true that we've got some zip codes in Austin where there's a lot of people vaccinated, but there's many areas where the vaccine rates are lower. So I think it's important to look at what is happening with why patients don't get vaccinated. And I really sit down and talk to my patients and ask them, there are patients that have concerns about safety. They feel that this vaccine was developed very rapidly, and it really was, there were over 50 years of research and many, many years developing this technology and lots of history of the vaccine safety. And this vaccine is very safe. So we need to really take the vaccine because this is really causing a very large problem in our community. And I'm going to say this in Spanish as well. Es muy importante entender que la vacuna funciona. El doctor Metzger habló de que todas las personas que estamos viendo más personas en el hospital y esas personas son las personas que no están vacunadas. Entonces, es muy importante que uno realice que la vacuna es segura y es muy importante recibir la vacuna. I want to just give my personal story. I really have looked at all the studies, and I vaccinated myself, and then as soon as I could, I vaccinated my children. And I really did that with trust that the vaccine is very safe. So I think it's important to talk to your family, as a physician, talk to your patients, understand their concerns, respect their concerns, and give them all the education that's necessary so that they become vaccinated. Thank you.
Dr. Iyer. You're still muted.
Hi, thanks for having me here today. I'm Dr. Meena Iyer. I'm the Chief Medical Officer at Dell Children's Medical Center. I'm a pediatric hospitalist in my training. As both Dr. Metzger and Dr. Douglas have stated, the number of COVID-19 cases has gone back on the rise after several months of decline. We continue to also see the illness increasing in kids. Though severe illness remains rare, we are seeing children getting infected, getting sick, and spreading the infection to others. We, as pediatricians, as well as family physician leaders, both across Ascension and Central Texas, support the CDC guidance that the COVID-19 vaccine is very safe, it's effective, and it should be given to everyone who's eligible to get the vaccine. The American Academy of Pediatrics has recommended that all children over the age of 2 continue to wear the mask, especially when they're returning back to school this year, regardless of the vaccination status. So we strongly recommend masking for all school staff as well as students over the age of 2, except for those with a medical condition that would prevent them from wearing a mask. With school soon right around the corner, it's very crucially important that students continue to wear masks at school, especially in elementary school where children are not yet eligible for COVID vaccines. Out of the 2 COVID vaccines, Pfizer is approved for teens who are about the age of 12, so it's eligible for 12 and above. And the vaccine, like both Dr. Douglas and Dr. Metza stated, they're free and it's easily available, and we strongly recommend everyone eligible to get the vaccine. There are some questions about the side effects from the vaccine for a child. How is it different from an adult? There are very short-term effects the child may experience when they get the vaccine, which is very, very normal. They may have a headache, some aches and pains at the site of the injection, but these are very, very short duration and they get resolved, and it's natural and normal to have these effects. I have myself received the vaccine, and after significant research and reading about the vaccine, and as it's very effective and safe, I have given both my family members and my kids. So everyone plays a very critical role in keeping us safe and spreading this virus. So the most effective way is to continue to mask, hand hygiene, social distancing, and getting your vaccine. Thank you.
Dr. Salman.
Hey, good morning. I'm Dr. Ghassan Salman. I'm the Associate CMO with Baylor Scott and White Health, Greater Austin region. First, I want to thank all my colleagues on this call and the Public Health Authority who put this conference call together. I wanted to touch base on the misinformation. I want to start by saying that, over the past 15 to 18 months since the COVID pandemic had started, there has been a lot of misinformation. And the misinformation by itself is a medical as well as a public health issue. This misinformation has led to hundreds of deaths, hundreds of unnecessary deaths. These people, our parents, children, fathers, neighbors, they could have been with us today. This is unnecessary preventable death that is directly related to the misinformation. And the best way to handle this misinformation is to really talk with your doctors. I have few recommendations for the people who are not vaccinated to think of these 3 elements when you're thinking of your vaccine. Number 1, talk with your doctor. Your doctor knows you and knows your medical illness. They will be able to answer your question based on knowledge, based on information, and based on research. Last year, yes, we admit we did not know a lot about this vaccine, but right now we know a lot. There's a lot of studies that can give us information. Number 2, I do recommend that you highly disengage the information from the emotions. We are humans and we're going through a lot. And there's a lot of emotions that can sometimes drive your decision. Try to balance your thinking with your feeling about the information. Number 3, when you hear information, try to think of the big picture. Try to think of more than just one piece of information. And to illustrate this 3rd point, I want to give an example that was shared at one of our board meetings. Not taking the vaccine is very similar to your decision of jumping off a plane and deciding that you do not want to open the parachute because you're worried the parachute is going to tangle with your feet. That's one information. When you get information, try to get information from both sides, information about the vaccine, but also think about the information, what will happen if you do not take the vaccine, and then consult with your doctor and then make decision. Put emotions on the side, talk with your doctor, get all the information, then make your decisions. Second, it's very important that you get tested. And it's becoming even more important you get tested because the symptoms of the variant are different than how we used to think of the symptoms a year ago. The new variants have symptoms that are more like a common cold or the flu. You are more to experience sore throat, headache, and fever than cough and shortness of breath initially. The loss of taste and smell are really not part of the presentation of especially the Delta variant. So I want to be hypersensitive to being tested. And if you get tested, you get positive, or you need to make sure that we use our mask, hand washing, and social distancing. I should recommend that for everybody because that's the most effective way to prevent the spread of the illness. With that, I'm going to turn it to Dr. Honeycutt.
Dr. Honeycutt, you are still muted, sir.
I'm very glad to be here. I just met Dr. Walks 2 days ago on the chance that a physician friend of mine here in Austin is very active in healthcare, suggested I watch a Zoom, and she did an excellent job of preventing, of discussing the upsurge in this virus, and it was very impressive. She then asked me to join in because I did, in fact, have COVID. But let me just give you a very brief history of the way it happened with me. Generally, I'm very proactive in my health, and also when I was in practice of orthopedic surgery in Fort Worth for 40 years, I tried to be the same way with my patients. We moved here in 2016 to be closer to our family. And I was fully vaccinated by February 21st. Following that, my wife and I, who's also fully vaccinated, we followed all the protocol that CDC recommended. We kept distance, we wore a mask, we did all the things you're supposed to do. And everything was going pretty well the way I hoped it would. And then on July the 1st, I woke up one morning with a severe sore throat, with a cough. I was just feeling generally crummy. But I thought it was probably just a bad cold. I never thought that this could be COVID. I'd had the vaccination. But the next day I woke up with the other symptoms continued, and I woke up with the loss of the sense of taste. That really rang true with me. I then called my internist, who gave me the excellent advice of going out, having the test done. I did that, and then to my surprise, the test showed I was positive for COVID. And I was not surprised, I was shocked. I said, how can this be? I've been tested. But I did what you're supposed to do. I followed his advice. I followed up with him. I received very little treatment. It just wasn't necessary because the next day I was feeling fine, and my sense of taste, which is important to me, was back within 1 week. And so I feel very blessed that I had a mild case. They're calling these mild cases, I believe, breakthrough cases for those who have been vaccinated, but still turn up positive. I am thankful that I had that vaccine, because had I not, like other speakers have mentioned, I could have been in the hospital very sick and even facing death. But because of the vaccine, it had a happy ending for me. Strangely, my daughter also turned up positive for COVID, and she'd had both vaccines. And our granddaughter, her daughter, also turned up positive. Now, they had vaccines as required or suggested, and we weren't together up until about 10 days or so before I started noticing symptoms. And now, whether or not that caused this, I don't know. It's really, I'll never be able to figure that out. We were down on the beach where there's a lot of open air, and but we were together quite a bit. But the important thing I want to emphasize is I had the vaccine, and how fortunate I was to have had that. The other points I would like to make is that if you think you may have the vaccine, you're not feeling right, and even if you've been vaccinated like myself, follow your symptoms, question the symptoms. And if you have questions that you don't understand, call your doctor or go to a public health system somewhere. And don't let that ride. And I was very fortunate that I was caught in time and I had the vaccine. The other point is that you will be protecting not only yourself, but other people by being vaccinated. I read some figures last night that Texas is less than 50% vaccinated, and Texas is one of the highest states with the upsurge, and particularly Austin. And so I think the advice given by the speakers before me and Dr. Waltz is very important. We need to. This is a team thing. We need to help each other, and I'm just very thankful to be here and get that vaccine.
Thank you, Dr. Honeycutt. At this time, we will move on to our question and answer portion. We have Molly Oak, who is our pool reporter, who will ask questions on behalf of the media, and she is representing KVUE. Molly?
Hey everyone, thanks for making yourselves available, as I'm sure you're all very busy, especially right now. This first question comes from KVUE. What, if anything, will change in the Stage 4 recommendations? And does the city and county plan to enforce the changes? If so, how?
So in Stage 4, we're asking people to wear masks when they are indoors and outdoors if they are unable to socially distance. And we're asking people who are unprotected by being fully vaccinated or having not received any vaccine at all to avoid getting out and gathering with people. And if they do have to go out for something that's essential, we're asking them to wear a mask. We're asking this of everybody, whether they're vaccinated or unvaccinated. We're asking them to wear a mask if they're outside of their home. As for whether or not we're going to be able to enforce this, we are not going to be able to enforce, but we are asking our citizens, our community, our neighbors. This is a call to action. We're asking that everybody take heed of where we are and work together to bring the case numbers down to help us get through this. Dr. Metzger, would you like to add on to that?
Oh, well, I think you said it well. You know, we're at a point right now of a surge, and so the best short-term fix of a surge is to start masking up again. You know, even those that we hope will get vaccinated by, you know, after hearing our message, that does take some weeks to become effective. So in the short term, the answer is to wear that mask. Thank you.
I completely agree with Dr. Messner. I just want to add one more thing, that masking at this stage has a multiplicative effect. The lack of masking can lead to not just 1 or 2 people getting infected. It can lead to 10, 20, 30. Protecting yourself by putting mask not only you're protecting yourself and your family, but you're protecting multiple other people. It's not a one-to-one relationship, it's a multiplicative relationship.
Yes, and I agree with that. And I think especially for pediatric patients, we as adults wearing masks can model a behavior of wearing masks and showing them that's the right thing, and kids will follow suit. So masking up and vaccination is what we would recommend.
I just wanted to add one thing about, Dr. Metzger did speak about this, that this variant, which is going to be the most predominant variant, is much more contagious. Where the original COVID, we thought one person would infect 3 people. The number, which is called the R0, one person can infect 6 people. So it's highly contagious. And we know that everybody's fatigued and tired of wearing the mask, but we know that it works. And there's some good modeling from the University of Texas that shows if we don't comply with masks, we will reach a crisis in our ICUs in a short period of time. And then, but if we do comply with masks, we can avoid that. So it's very essential. And it's been proven that it works.
This next question is from CBS Austin. What does the move to stage 4 mean for large events such as soccer games and concerts? Are venues still authorized to operate at full capacity?
We've not made any changes to capacities. We're making this plea to individuals, citizens, community members, neighbors, loved ones, friends. We're asking them to get vaccinated, number one. And we're asking them to wear a mask to protect themselves and everyone around them so that we can get everybody vaccinated and protected and decrease the number of cases.
The next question is from Community Impact. Dr. Metzger mentioned protecting unvaccinated children. For local children with COVID cases now, how are their symptoms and experiences different compared to several months ago? How is the Delta variant affecting children?
So this is Nina. I can take this on. So we do see patients, pediatric patients with the Delta variant who have been admitted to ICU. They are a little more sicker than when we saw last year. And the number of patients, the pediatric patients with the infection is much higher with this wave than what we had seen last year. So we have a lot of patients with the variant being in an ICU, coming with symptoms of cough, fever, headache, and getting really sick. But with the treatment that we have been able to take care of them and help them recover.
The next question is from the Austin American Statesman. Is Dr. Walks now urging local business owners to again put masking policies in place?
I'm asking everyone in our community to help us get through this next phase in our pandemic with this new variant. We're asking everyone to put a mask on, particularly in indoor settings. And our business community has always stood with us and helped us get these things done. And so we're, again, calling on everybody to put a mask on.
The next question is from Co-op Radio. Is there a plan to accurately test for antibodies, particularly in the immunosuppressed or transplant patients, to determine if and when boosters are necessary?
There's not currently guidance to do so. We are currently following CDC guidance, and the guidance to date is for all people who are eligible over the age of 12 to receive a full series of vaccinations, and that's 2 shots of the Moderna or Pfizer vaccines and 1 shot of J&J. We have not been given guidance on booster therapy at this point, and we're not doing antibody testing to assess anybody after vaccinations. That's being done on a scientific level, but not routinely.
I'd like to add, and it's true, one thing to understand about the antibodies is when we get an antibody test, that may not correlate perfectly with what it's talked about neutralizing antibodies, and that's done in a laboratory, and that's more accurate. So getting, just an antibody test may not be accurate. I think it's also important to know that some patients that are undergoing chemotherapy are very old or have other immunosuppressive conditions may not have high neutralizing antibodies. But what we do know still is that the vaccine helps prevent severe disease in all groups. So still recommending vaccinations, but that's another reason we should wear masks, is to protect those vulnerable people in the community.
Yeah, yes, I'd also like to add, as Dr. Metzger, just want to add that tracking and that decision about boosters is really a national decision. It's a CDC, it's an FDA decision on when that occurs, and that's driven by data. As others have mentioned, antibodies are a big part of that, but also their T-cell immunity as well. They're tracking how long lasting that is and in what age groups and comorbidities. And I think even today there is the first meeting of the advisory committee on immunization at CDC to start to discuss this very topic, that we might be looking at boosters for a certain segment of the population this fall, but that's still to be determined. Thanks.
I completely agree. I just want to add one small piece of information to the comments, is that I've personally seen patients who ask me if the infection itself can bring immunity. And theoretically it may, but we should not rely on just having the infection of the COVID as a way to protect you from future infections. The recommendation is still getting the vaccine if you get infected or not.
The next question is from the Austin Chronicle. Since last week's confirmed cases of the Delta variant in Austin, is Austin Public Health now testing new cases for the variant?
We have limited resources in our community for sequencing, which is what the term is used for determining whether or not the variant is Alpha or Delta or whatever. And those tests are being done on a case-by-case basis. And again, I want to emphasize the fact that if someone tests positive for COVID-19, the doctors that are taking care of patients with COVID-19 are still going to proceed with the supportive care that's needed and all of those things that we do to treat those patients. And the sequencing is more of something that we need to know from a public health perspective to see what it is, how the variants are impacting our case numbers. So the lack of testing every person that tests positive for COVID is not as important as the fact that we have to test to identify who has COVID-19 and thereby treat them appropriately, have them be placed in isolation at their homes with their own rooms, their own bathrooms, so that we can protect our community from further spread of COVID-19.
The next question is from KUT. Why are people who have been vaccinated being asked to wear masks? Is it primarily because of concerns that they could be asymptomatic and spread the virus to those who are unvaccinated? Or is it because of a rise in breakthrough cases?
We are seeing people who have been vaccinated who develop COVID-19. They've been fully vaccinated. They've received both shots. And this is expected with vaccines. We don't have 100% protection. So there are some people who unfortunately may develop COVID-19. And as a result of that, we also know that we need to protect ourselves in this instance. This is a Delta variant issue in that this is a much more easily transmitted virus. It spreads faster between people. You heard Dr. Douglas say that the R0, the number of people that one person can infect is 6. So if you have COVID-19 and it's the Delta variant, you can infect 6 other people. If those people happen to be vaccinated who are getting COVID-19, they're getting a milder case of it in many instances, but there are also people who are asymptomatic. And because of that, in both of those instances, those individuals could spread it to somebody else who may not be vaccinated, for instance. So we are asking everybody to wear a mask, those who are vaccinated and those who are unvaccinated, because we're seeing such a spread so that we can get the number of cases to decrease.
I wanted to comment, like we talked about that the last time we were in 4 was in February. Well, and there's so much fatigue about this, like this is happening again, but we're not at the exact same point. We now have the vaccine. And so we have 2 protections. The vaccine, it doesn't prevent 100% asymptomatic carrier. We still can carry the virus and spread it to somebody, but it is felt that the vaccine helps you carry less of the virus. So now we're in a better situation because if we all get vaccinated and we wear the masks, this is the surge. We could really make a great and fast effect on the surge. So it's twofold, 2 things we need to do, but that will be very effective because I think sometimes we're so fatigued that it's like, what's the point? Well, there is a definite point in both those measures.
The next question is from Box 7. Should Johnson & Johnson recipients get a Moderna or Pfizer vaccination to protect them from the variants?
The current guidance is that once you're fully vaccinated, there is no requirement for a booster, and that includes having another vaccine being given after the single dose of Johnson & Johnson.
Yes, I agree. I think there's just not the data to support that yet. And so the recommendation is just to continue without booster for now. But it is something that's consistently being looked at. And so if that need arises, then I'm sure that will be recommended.
The next question is from KXAN. Do local hospitals have the staff and capacity to handle another surge in hospitalizations? Will you all need help or need to bring in help? From where and at what metric do you request that help?
As we speak, our hospitals are maintaining and able to care adequately for our patients in our hospital systems. But it's up to our community to do what we're asking today, this call to action of wearing masks, and if you're not vaccinated or fully vaccinated, going out and completing your vaccine series. It's up to us. We are in a surge mode right now, and we're planning, and we are anticipating that if we do need to have staff, that we will request assistance from the state. However, it's up to us. We have to put on our masks, and as Dr. Douglas just said, it's twofold: put on a mask and get vaccinated.
Yeah, I want to echo Dr. Walk's comment. This is Dr. Salman with the Baylor-Scott-and-White. It is much easier to answer this question now compared with 1 year ago, because we really have developed the muscle memory and the experience of how to handle surges. I can tell you from what we know about our organization and the hospitals in Austin, we are still able to handle both the COVID and the non-COVID patient, fortunately. We are thankful for the CATRAC for providing us with the staff, because that's a critical aspect of taking care of our patients. But the main thing from the public perspective is that the activity of each individual person may make a big difference. We're really asking for take the vaccine, put the mask on, wash your hands, and avoid social gathering. Keep your social distance. You can make a big difference, you yourself.
The next question is from Telemundo Austin. They asked that Dr. Douglas respond in Spanish. With breakthrough cases being reported in our area, how do you convince those who are not vaccinated to get the vaccine, especially the Hispanic community, who has one of the lowest vaccination rates?
Bueno, esa es una excelente pregunta, y yo tengo muchas conversaciones con las personas hispanas y les pregunto por qué no quieren la vacuna, y con todo respeto, porque sé que muchas personas, hay demasiada información que que es incorrecta. Yo creo que la mayor preocupación es una de seguridad con esta vacuna, que justo estaba hablando con alguien que me dijo, en mi comunidad todos tenemos miedo porque sabemos que esta vacuna te puede enfermar o puede tener problemas. Y entonces uno tiene que hablar y educar y respetar esas personas y explicar que eso no es el caso. Se han vacunado millones y millones de personas y es muy segura esta vacuna. Y también decir, yo he vacunado a mi familia, yo vacuné a mis hijos para proteger a la comunidad, para proteger a mi madre, porque ella tiene la vacuna, pero es muy viejita, probablemente no está muy protegida. Entonces explicar eso, yo no daría la vacuna a mis hijos si yo no pensaba que esa vacuna sería muy segura. Entonces creo que tenemos que sentarnos con esas personas que tienen miedo, con todo respeto, y explicar, y espero que eso pueda convencer. Y el otro punto es que las personas que no se están vacunando son las personas que están en el hospital. Y esos números es la razón que ahora estamos con otra vez en el nivel 4. Y yo les quiero preguntar, ¿quieren que llegue la situación otra vez donde no podemos ir a trabajar, donde no pueden los chicos ir a la escuela? Yo no digo que eso va a pasar, pero es una posibilidad. Entonces hay que realmente pensar, agarrar buena información y vacunarse.
We are now moving on to the second questions from the news outlets. This one is from KVUE. DSHS reported ICU beds were at the third lowest since the start of the pandemic yesterday. I believe the number was 31 for the Austin area hospitals. What is your reaction to that, and how concerned are you going forward?
Well, I am concerned, and that is one of those factors that has led me to the decision to recommend that we move to stage 4. The decision was not made lightly, and we meet regularly with hospital systems. They have beds, they have equipment, but we have staff, and the staff are stressed and strained and have been working for over 18 months to care for patients. And so our real concern is that we make sure that our hospitals are supported, and that is why if we have to, we will be requesting help from our state leadership to get staff to come in and support us so that we can expand our ICU bed capacity. But right now, we are managing, and right now we are asking the community to stand with us to support our healthcare providers and stop the spread of this virus. Protect yourselves, your family, and your loved ones. Get a vaccination and wear a mask.
I would like to speak to kind of a personal plea, or for the people in the hospital that have worked so hard for 18 months. We're asking, please put on a mask and get vaccinated. But put on a mask is so simple. When I think about when the ICU nurses start hearing that the surge is here and it's coming, I see this look of just really, they're overwhelmed. They work, they had to be in patients' room completely with these masks that were so uncomfortable, work so many hours. We're tired, and they're tired. And so I just ask that you think about that and wear a mask. That will make such a big difference.
I would echo that too, especially in the pediatric world when we have our patients, but the families are not able to visit them because they are sick with COVID and admitted. It does affect patient care, healing, and recovery. So we strongly advocate for wearing a mask, social distancing, and getting the vaccine so we can curb this illness, because there are other illnesses along with COVID vaccine that we're taking care of in the hospital. So please take your vaccine so we can take care of this disease.
Yes, that brings up a topic for me that I think is important. You know, the vaccination rate basically decreases with age. And as I pointed out earlier, 7 of the 9 patients in my ICU right now are under 50. And I can tell you, you know, with us talking with those patients, they didn't think they were going to be in this situation. You know, and I want to address younger people that maybe think that, you know, oh, I can get through this. This is nothing. Well, I can tell you those people in the ICU thought the same thing, and yet there they are, and you know, regretting that decision. So please don't get to a position where you regret that decision. Thanks.
And I was asked to just let you all know that was the first round of questions. We are going over time, so if you do have to go back to patient appointments, you can drop off as we continue on this last round of questions. This next one comes from CBS Austin. Are health leaders making any recommendations for schools other than mask wearing, and should virtual learning options be considered for grade levels not yet eligible for a vaccine?
As we've heard recently, and we all have supported the American Academy of Pediatrics guidance that children and over the age of 2 with no issues with wearing masks for whatever reason, medical conditions, and staff, that whether or not they're vaccinated, that they should wear a mask. That's come out recently, and we stand in support of that. For those people who are able to be vaccinated, we want them to be vaccinated. And I'll pass this over to Dr. Iyer to add her comments as a pediatrician.
Agree. We will strongly continue to advocate for masking about the age of 2 and above, and vaccination for everyone eligible. And over the last year, we have seen as kids don't go to school, they do virtual learning, that social interaction not having has significantly increased our mental illness. And there's been a spike in that and several other illnesses. Yes, we can consider virtual option, but we really would like those kids to go back into school, work with each other, have that social interaction so they can grow developmentally as a wholesome individual. So to allow that to happen, we would like everyone to get vaccinated and continue to wear a mask.
The next question comes from Community Impact. What would cause Dr. Walks to consider recommending virtual learning?
I, at this point, am in support of the American Academy of Pediatrics recommendations regarding in-person learning and allowing our children to get back to school. They've had a loss of learning in a lot of different communities because they haven't had the social interaction, because they're not able to get that one-on-one instruction that they have in in-person settings. And so we stand in support of in-person learning. There may be instances where virtual learning may be necessary, but we all stand in support of our children being able to go back to school. And we're going to be able to achieve that if we go out and get vaccinated and if we start to wear a mask.
I would again echo that. We would like kids to go back into school, be with each other, social interaction, and like I stated earlier, mental health illness has seen a crisis in the country. Even we adult children have seen a significant increase in number of patients showing up for mental health illness and admissions. It's because of not having that social interaction. And the other thing is also kids not able to have access to food, to nutrition, instruction. There's a huge impact on the growth of a child and not being able to go back to school. So if we continue to wear a mask and get vaccinated, we can safely bring the kids back into school and continue with their growth.
The next question is from the Austin American Statesman. Is Dr. Walks making any recommendations to stop the spread of disease in crowded bars like those on 6th Street? What will those recommendations look like?
Our call to action today is for people who are unvaccinated or not fully vaccinated to go and complete their series of vaccine or go and start that series. We're also asking people to wear masks in indoor settings in particular so that we can stop the spread of this disease. We're also asking people who are unvaccinated to avoid gathering in crowds so we can stop the spread of this disease. We're asking people to take personal responsibility, get vaccinated and wear a mask.
The next question is from Co-op Radio. Does the vast global number of unvaccinated who contract and recontract COVID make it too easy for the virus, thereby slowing its devolution into a less virulent disease like the 1918 flu did over the last century?
Anytime that we allow this virus to replicate in another person is an opportunity for the character of the virus to change, and that's what we call mutations. And as the virus mutates, we're going to be faced with a new set of challenges. So it's important for us to take away from this time that we've been spending with you that we must protect ourselves with vaccination now. We have vaccines that work, and we need to protect each other in the meantime by wearing a mask so that we don't become infected.
A principle in infectious diseases is that viruses and bacteria, when they mutate, they don't become more friendly. They actually become worse. They can develop antibiotic resistance. In this case, this virus has learned to attach much more readily and spread. And so that's the big concern, is that these viruses can become much more contagious and change to escape protection from escape the immunity. So definitely want to prevent the replication of this virus, and the one way is to get vaccinated.
The next question is from Box 7. Doctors tell us a nationwide nurse shortage is causing problems in hospitals here. What is being done to prepare for a surge and ensure hospitals are adequately staffed? Please provide staffing and capacity numbers.
We are here today to talk about what we can do as a community to stop the spread of COVID-19. We have announced that we're going to stage 4, and that is our way of helping this community decrease the spread of this virus in our community. In doing that, we will assist our hospitals in continuing to provide care for our citizens. Our capacity to take care of people is there. Our staff stay ready and willing and able to take care of patients who are sick. But it's up to us to make sure that we can continue to do so. And we're here today to ask you to put on a mask, to keep yourselves safe and to stop the spread in our community. And we're asking those who have not been fully vaccinated or who have not started getting vaccinated to go out and do so. We are ready and willing and able to request assistance when that time comes. But it's up to us to make sure that that time doesn't get here. We need to get vaccinated and we need to wear masks.
The next question is from KXAN. Based on current models, and specifically for people who might be experiencing COVID fatigue, when do you estimate we will return to a more normal life without these steps backward into stricter guidelines?
I don't have that crystal ball. But again, if we have people who are vulnerable to becoming ill from COVID-19, as long as we have people that can become ill, as long as we have the ability to spread this disease between people, we will have to keep dealing with this. So it's important that we get vaccinated, and it's important that we wear masks.
I think
Yes,
oh, I'm sorry.
Yes, we know that, oh, well, you go ahead. Sorry, I jumped in front of you. Oh, go ahead.
Talking about COVID fatigue, it really is true. And unfortunately, the COVID fatigue became sort of like saying COVID is gone. And we saw a tremendous drop. Even before we saw the surge, we were looking at the vaccine rates that had really gone up and then completely plateaued and started going down, even though vaccines are very easy to get right now. So one thing to understand is COVID will be here until and it'll be critical and it'll make a lot of people sick until the vast majority of people are vaccinated, way above the rates that we have. And so it's up to us. It really is, I think. And COVID is not gone.
Yes, I completely agree with that. I was going to say, you know, we don't know when the end of this will occur. We certainly don't see it in sight right now. But what we do know is what will get us there more quickly, and that's through vaccination, which then in turn creates herd immunity. Thanks.
This is the last question. It's from Telemundo Austin, and once again asking for Dr. Douglas to respond so she can respond in Spanish. How effective are the current vaccines against the Delta and Lambda variants? And how soon will infectious disease experts know if people will need a booster shot in the fall or winter when flu season becomes another health concern? And then I'm also going to ask that that gets answered in English as well.
Dr. Douglas?
I'm going to answer this first in English. We do know that the vaccines, they have been studied against the variants, and the most important thing is they protect from severe disease. They're very good, way above 90% of preventing ICU admissions and very good at preventing hospitalization. So they protect us. Depending on what study and what variant, you can still have a breakthrough and could have an asymptomatic or mild illness, but they're very effective at preventing severe disease. And the reason that we're having this shift to level 4, it has to do with hospitalizations. It's not about just how many COVID cases, but hospitalizations. So if we have a tool that prevents hospitalizations, we should all utilize it. Regarding the booster, there's lots of ongoing studies, and that is the FDA is looking at that, and there's lots of conversation. I do not know exactly when that'll be considered. I'm feeling possibly in the fall, but I'm not certain about that. Entonces, lo que quiero hablar es que la vacuna es muy eficaz contra los variantes. Se ha estudiado y sabemos que la vacuna previene la enfermedad severa y es una vacuna muy buena, casi 100% que previene la admisión a terapia intensiva y también a las hospitalizaciones. Hay casos donde las personas son vacunadas y pueden tener este pero es una enfermedad leve y es una enfermedad donde uno no tiene síntomas. Y toda esta conversación que estamos teniendo, ¿por qué estamos yendo al nivel 4? Es por las hospitalizaciones. Entonces, si todos nos vacunamos, vamos a prevenir hospitalizaciones y muertes por COVID. Entonces, tenemos una herramienta ahora que no teníamos el año pasado, donde podemos prevenir y volver a la vida normal. Entonces, la segunda pregunta era sobre si va a haber otra vacuna que se va a administrar posiblemente en el otoño. Todavía se está estudiando ese tema para ver cuándo y quién debería usar esa otra vacuna que lo llamamos el booster. Gracias.
And thank you for that. Dr. Walks, over to you for your closing comments.
I want to thank all of my colleagues for being with us today and sharing their experiences with our community and joining me in asking our neighbors and businesses and friends and loved ones to put on a mask, go and complete your vaccinations, wash your hands, social distance, get tested if you have symptoms, and please, let's get through this. We've been in stage 4 before. We know how to do this. And I ask you to stand with us and stand with the nurses and doctors and dietitians and everybody who's been working tirelessly to get us through this pandemic. And let's focus on the end of it. Let's get vaccinated. Thank you.
Thank you. That concludes our media availability for today. Thanks to Dr. Desmar Walks, Dr. Brian Metzger, Dr. Elizabeth Douglas, Dr. Mina Iyer, Dr. Ghassan Salman. Thank you for joining us today. Have a safe weekend.